This is Next Steps for Seniors with your host, Wendy Jones. Each week, Wendy brings resources and information to help guide you through those next steps with elderly parents and loved ones. You can follow, subscribe, and share on your favorite podcast platform. If you have questions or topic suggestions for Wendy, you can call us at 248-651-5010 or email at hello@nextstepsforseniors.com.
Hello, and welcome to Next Steps for Seniors, Conversations on Aging. I am your host, Wendy Jones, and in our studio today is Dr. Pamela Pyle, and our topic is ending well. I know that seems pretty deep, but it's real, and life is real, and how we end has a lot to do with our lives. And that's why Dr. Pamela Pyle is here with us today, because we want to talk about the medical and practical perspective to end of life, because guess what? It happens to everyone. Nobody has a special pill they can take that they don't have to go through aging and they don't have to end their lives at some point. Of course, we all know we go to heaven, which is so much better if we're believers, but we're going to get into that later. Right now, we are going to talk about the medical and practical perspective of end of life. So Dr. Pamela Pyle is in the studio, and she is a board-certified internal medicine physician. She is an author of Anticipating Heaven, which blends a medical knowledge and spiritual insight in an incredible book that I have read that is very good.
Thank you.
She is a global speaker and known for addressing aging and end of life with compassion and clarity. And that, Dr. Pyle, is why you're here. And I know, call you Pamela, but hi, I'm so glad you're with us today. Thank you for being with us.
I am so excited to be included and consider it a privilege.
Well, we have a lot to learn from you. You have been in the hospital setting for years. You have a lot of medical experience, and especially with patients. So we would love for you, because obviously we can't summarize the entire book, but if you can share with us, one of my first questions is really from a medical perspective. If you had to narrow it down for families, how can we just better navigate the healthcare system, especially with our aging loved ones?
I would say the first thing is preparing in advance. You mentioned that we're all going to die, and so often we don't want to think about that, but death is 100% fatal. So one of the ways I rephrase that is we got to live with the end in mind. And when we live with the end in mind, it also makes us have better days today. But to have our best days, especially when we're navigating healthcare, preparation is really important. I'm going to use an example, even something as simple. If you were to call 911 from your home, what hospital would you be taken to? Would it be the one that your doctor visits, or that you've been to before? Or because of the location of where you live, it would be entirely foreign system. Having an idea of those initial steps is an example of being prepared. When you're looking at your doctor and also your hospital care system, you also want to know that you are having the right questions at the right time.
Mm-hmm.
And Wendy, you know, we've talked about this. Knowledge is power. So, from that perspective, I really want to equip those with the principles of knowledge that is in the book, which is applicable to any healthcare system, but also to Medicare, which many of us are. I'm almost there. Can't wait because be able to get that pay
benefit.
raise.
Yes.
Pay raise.
And it's a big benefit to so many people.
It is a big benefit. But we want to navigate in advance of a crisis. And, you know, our parents might not feel comfortable talking about that. But if the way I explain it, my mom is a perfect example, is I want you to have your autonomy for as long as possible. The decisions that we discuss today or the journey we walk today will help that happen. And autonomy, for all of us is so important. And it's also one of the things that all of us fear losing as the number one fear approaching our final years. And so preparation, right questions, right time. An example, if you were to go to the hospital, you want to ask the doctor that's admitting you, what time will you be doing clinical rounds, so that myself and my family can be here and be prepared to ask our questions. And then a little, I call these life hacks, is the night nurses are often in a less stressful setting, in that they have more time, more patients are sleeping, and this may be an opportunity to ask the nurse, what questions should I ask? And then one of the key questions that is universal, if you forget anything else I said, this question of, if this were your loved one, what would you do? And that humanizes the clinical patient relationship. And we want that from our doctors.
Right. Right. And I love how you mentioned, nurses are a key component in this picture. We all know how busy and full the lives of a doctor are, and the nurses are their right hand, and they're in and out. They know you pretty well, and they're the ones communicating too with the doctors back and forth. So having that extra time, I love that you mentioned that at nighttime when other patients are sleeping, and you just kind of get their ear and start talking to them and say, what would you do? Give me some ideas of questions to ask, because it's overwhelming. And I love that you said an advocate with you too, because, as we age, we lose our hearing. We can't hear some of us, not everybody, or see for that matter. And having an extra set of hands on, sitting there listening, a lot of times I even ask, and I don't know what your thought is on this, do you mind if I record this just so I can listen to it later? Because they're talking so fast and you're trying to take notes in the hospital, and all of a sudden they leave, and then you're like, oh my goodness, what did they say about that? You know what I mean? Just little things like that.
I love that.
Yeah.
Although I will say not all doctors will. We live in such a legal society that, they're thinking, are they listening for me to make a mistake? But I think the way that you approach that is, so that I can remember everything that you said, because what you're saying is important.
So important.
To myself or my loved one, may I record it.
Right.
And very rarely, if with the right spirit, will a doctor say no. And actually, they can't say no. It is your right to record it.
Oh, well, there you go. So I want to talk about, in Chapter 5 of your book, it's a bargain and a treasure. And you talk about planning together, because I feel like one of the most difficult things that we kind of experience is everybody being on the same page and actually having a conversation about aging and how you want it to go as you age. So one of your biggest things that you wanted to mention was the advanced care plan, and talk about how that can affect the entire family. And I got to tell you, I love what you did. And she, just so everybody knows, I'm giving away Chapter 5, but in her book, for her birthday, she said, hey, it's my birthday. This is what I want for my present. I want the whole family to get together and have this discussion about ending well, right?
We don't know what tomorrow holds, no matter our age. And I call these gatherings a G3 Summit, which is a generational generosity gathering.
I love
And
it.
when we're loving those that are in the older generation, ourselves in the middle, our children and our grandchildren, we want to do things together. And when we just have the conversation with an older parent, all of a sudden they're facing their own mortality in a very stark black and white way. But if we approach it, this is important for me because I want you to know what I would want in these circumstances. And you're not doing it in the middle of a crisis. And then, even for your college kids, your adult children, they think they're immortal. So having these discussions is really good for every generation, including ours.
It really is. It really is. And if you say it like you did, for my birthday present, I want everyone together. We have to come up with a way to do that sometimes just to get the whole family in one spot at one time. But we're going to talk about this advanced care plan in our next segment. So stay tuned with us. Dr. Pamela Pyle is a blessing, and she's got a lot to say about this topic. We'll be right back.
Hi, everyone. Super Bowl champ Vernon Davis here from Legal Help Center. If you've been injured in an accident and think you deserve compensation, listen up, because we have legal professionals standing by right now to answer your questions for free. You can find out if you have a case and how much it's potentially worth.
Thanks, Vernon. You heard it, folks. If you've been injured, call and find out how much you qualify for. Call 800-497-4410. Advertisement sponsored by Legal Help Center. May not be available in all states.
Welcome back to Next Steps for Seniors, Conversations on Aging. We are here today with Dr. Pamela Pyle, who has been such a blessing to us already and has so much more to say about advanced care planning. And, this big birthday party that she threw for herself and invited her whole family and said, we're talking about ending well. And that's our topic today, ending well. So, Pamela, share with us the steps with the advanced care plan and what your recommendations are for our listeners, because really the number one thing is having the tough conversation with people, right? Especially the people closest to you, because nobody wants to talk about this stuff. Nobody does.
Until you have to, and then it's makes more chaos and it's more fearful. And so if we make a will, we do a lot of planning. If we think about from planning for births, planning for weddings, why would we not want to plan for a time when we're sick and can't make decisions for ourselves? We don't know when that will occur. But as a physician for over 3 decades in the hospital, I can tell you it happens all the time. And while there's a lot of data showing the benefits of completing an advanced care plan, only about 30% of Americans do. And that's really a sad statistic. It doesn't take that long. I actually am a big fan of one that is called the 5 Wishes. And I like that for a variety of reasons. One, it's founded by a gentleman that worked with Mother Teresa, a lawyer that had a heart for taking care of those that were aging. But also, at this point, and it has been for really 30 years, it's only $5. I mean, you can't even buy a latte for $5. Their website, the5wishes.org, is very easy to navigate. You can do a digital option where it's stored in their online services. Mm-hmm. I believe that one's $15. But they also even have resources called conversation starters. And if you don't necessarily want to have a party like I did, but you want to, but you, I'll do anything to get my kids.
Yes, most definitely.
I lost my train
No.
after
The
thinking
5
about
wishes you could follow. Right. The website. Mm-hmm.
Right. And really, so the other benefit about 5 wishes, it's called a plan with a heart and a soul. So each of the wishes addresses different aspects of care. And if you think of advanced care planning as being the voice that speaks for you if you were not able to speak for yourself. And again, we don't know if we'll ever need that, but quite probably we will at some point. And so the first wish is how to choose a healthcare proxy. And a healthcare proxy is someone that is within your family or even beyond your family. But the greatest characteristic is that they know what you would want if a decision had to be made. And sometimes it's not always your children that should be making the decision because they're so close, to the subject. Right. And mm-hmm. You don't want any discord around that topic.
I just have a quick story I have to share because it fits in perfectly here. So I had a client who had his wife as the healthcare advocate, and what ended up happening over time is the wife was doing everything she wanted and not doing what he wanted. And the role, and you got to take this so seriously, is to honor the wishes of the other person. And if he actually ended up changing it to his son because his son and him thought alike and his son wanted what the dad wanted. That's the role. You don't get to do what you want. I mean, it's not about you at this point. It's about them. So anyway, I just had to share that because let's keep in mind any type of person that an advocate is supposed to be thinking the way you want to be thinking. Okay, so thank you. I just had to share that story because it was shocking.
And we never know, the wife in that story. We think that we're going to do right by what our loved one wants, but we're all clouded by our emotion in that moment. But that reminder of it really is what the patient wants, and we might not agree, but if we truly love, we're going to do what they want. And like I said, sometimes that is not a family member that's best for that process.
Right. And I think that's important, too, to understand. Some of the other things, choosing that right person is big. What's another thing on the 5 wishes that's important?
Well, it's the equivalent of a living will. I believe more people have heard the term living will. That's definitely been available on a longer basis. But a living will is really addressing care in the event of a crisis. Would you want to be placed on artificial life support? Would you want a feeding tube? In the event of a severe medical crisis, how would we make decisions? Will we go just based on this document? Or what if it's more complicated? One of the things I like about the wishes is it addresses serious issues where the person can't speak, but it also teaches that principle of how to make decisions. For example, my husband and I are pretty universal on how we would approach this. So I wouldn't worry about him being my healthcare proxy. But he's not a doctor, and you do want some advice from the clinician that is guiding the decision-making at the end of life or in the midst of the crisis. And so one of the ways to be assured that the doctor is giving the full picture for the healthcare proxy to make the decision is to ask that two clinicians be in agreement in the journey. And that could be an internist and a neurologist or a surgeon, or your own trusted clinician. But it is a complex process, but I like the idea of it being two clinicians in agreement.
I 100%, when I read that in your book, thought to myself, that is so brilliant, and not many people think of that. And then that just gives you the extra confidence that you need to make that decision, saying, you know what, her wish was that I have two people in agreement in the clinical setting, right, before, and then I also am in that agreement, and then I know it's the right decision. Yes, that's great advice. I love that. One last question. You talked about a very brave person in your book, the bravest death that you've ever witnessed.
Yes.
Can you just share that? We've only got 2 minutes left, but I really want our listeners to hear this.
It was a gentleman that had a lung disease and had been in and out of the hospital on a ventilator, which is artificial breathing. And on this visit, he didn't want that anymore. And we tried to give him respirations via a mask. And he really was intolerant of that due to his claustrophobia. But his underlying disease was terminal. And he really looked at his wife, who was on one side, and myself on the other side of the bed, and said, I'm ready to go. Just let me go. And because I knew this family well, and his wife was okay. She'd never been okay prior to that moment. But he went bravely to his final breath. And I want to be able to make that choice myself. As I'm ready to go, and I have peace at this moment. It's such a gift for those we love.
Amen. Amen. And that's why we have advanced directives, right? Because do not resuscitate is one of them. And when you go to the hospital, you have a decision to make. And if you want to end your life with peace in a situation like this, and both parties have peace and you're ready, then you're ready. It's time. We're not meant to live forever. We're meant to move on to the next step.
Yes.
You're listening to Next Steps for Seniors, Conversations on Aging. Thank you, Dr. Pamela Pyle, for being with us. And please get her book, Anticipating Heaven. It's incredible.
Thank you.